Let's talk about diabetes today. Diabetes is a chronic disease in which body do not produce insulin or the insulin produced cannot be used. That is, body develops resistance against the insulin. This leads to damages with the passage of time, like nerve damage, blood vessel damage. Diabetics is basically of six types. That is diabetes insipidus, type 1 diabetes and type 2 diabetes under diabetes mellitus, gestational diabetes, latent autoimmune diabetes in adults, maturity onset diabetes of young. So here in this video, I will discuss about diabetes insipidus, and serially the other types of diabetes will be discussed in upcoming videos. The risk factors for diabetes are obesity, high cholesterol level, hypertension, genetic diseases, symptoms like weakness, itchy skin, thirst, weight loss, weight gain, high glucose level in blood, and frequent urination. Tingling fingertips are the symptoms. Tingling fingertips basically include prickling, like someone is prickling your tips with a needle, tingling and numbness. The complications that occur due to diabetes are nerve tissue and blood vessel damage, retina damage leading to loss of vision, heart and kidney damage, diabetic foot, which is basically the food problems like ulcers and infections. It can be prevented by controlling glucose level, exercise, and eating healthy. So let's start with diabetes insipidus. Diabetes insipidus is a rare disorder that causes the body to make large amount of urine. Normal people produce 1 to 3 liters of urine per day, while the person with diabetes insipidus produces up to 20 liters of urine in a day. The disorder of excess urination is polyuria, which in turn increase the urge of thirst. That is a condition called polydipsia. Approximately 1 in 25,000 people worldwide suffer from diabetes insipidus. The symptoms basically include high thirst, urge, slow healing of cut and sores, fatigue, weight loss, high urination rate, and blurred vision. Now, who is at risk of having diabetes insipidus? So basically, people of all age can develop the type of diabetes. However, a person is at risk if he has family history, had brain surgery, or major head injury, which can damage pituitary gland. Take medicine that can cause kidney problem, example being diuretics, furosemide, chlorothalidone, bipolar disorder medicines like olanzapine, clorazapine, and a person with metabolic disorder, that is high calcium, low potassium in the body. Basically, a bipolar disorder is a mental illness that causes shifts in mood, activity level, and concentration. So a hypothalamus is an important part of brain. Basically, the brain is divided into three parts. Brain is divided into three parts. That is forebrain, midbrain, and hindbrain. In forebrain, which is a largest part of the brain, there lies a hypothalamus connected with pituitary gland. So what happens here is the hypothalamus is responsible for functions like temperature, hunger, thirst, and sleep. Pituitary gland is connected by hypothalamus and receives signal from it to produce various types of hormones. And thus, with respect to the urge of thirstiness, hoarseness, or with respect to the urge of thirst, the pituitary gland signals for more water intake. Also, pituitary gland is responsible for secretion of vasopressin, which is responsible for absorption of more water from the urine in normal cases, but in diabetes insipidus, vasopressin is missing and therefore large amount of urine is produced. We'll be discussing it in the later slides. What are the complications of diabetes insipidus? The complications include dehydration, dry mouth, dizziness, tiredness, difficulty performing mental tasks, nausea, and fainting. What causes diabetes insipidus? So here we'll discuss the role of vasopressin. It occurs due to the lack of vasopressin or less vasopressin hormone synthesis, which helps the kidney to regulate the amount of fluid in the body. It's also important to note that vasopressin is also known as antidiuretic hormone. There are four specific types of diabetes insipidus, that is the central diabetes insipidus, nephrogenic diabetes insipidus, dipsogenic diabetes insipidus, and gestational diabetes insipidus. So let's discuss about central diabetes insipidus. Central diabetes insipidus occurs as body produces less vasopressin. It is produced by pituitary gland in brain. Thus, any damage to brain, infection, tumor, autoimmune disease can cause the disease. Also, the genetics of the person is important. When the amount of fluid is less in the body, pituitary gland signals the release of vasopressin in the blood. The hormone signals kidney to retain water by absorbing water from the urine which is being produced. No hormone means no absorption of water, that will eventually lead to high urine production. The next is nephrogenic diabetes insipidus. Here the body makes enough antidiuretic hormone, that is vasopressin, but the kidney do not respond to the hormone, thus leading to high urine production. It may be due to the medicines which have been taken by the patient, low potassium, high calcium in the blood, the blocked urinary tract, inheritance, and chronic kidney diseases. The next type, the dipsogenic diabetes insipidus. Here, hypothalamus causes the urge of thirst, leading to more water intake and higher urination. It can be due to damage of hypothalamus, inflammation, tumor, head injury, infection, and medicines. The next type is gestational diabetes insipidus. It is a rare temporary type of diabetes which occurs during pregnancy. It occurs when mother placenta produces enzymes that breaks down the vasopressin or antidiuretic hormone. Women with more than one baby in the womb develop this condition due to the more placental tissues. The liver breaks these placental enzymes to some extent, but if the liver itself is affected by some disease, then there is higher chances of gestational diabetes insipidus. Examples include preeclampsia, pregnancy complication, high blood pressure, protein in urine after 20 weeks of pregnancy, HELLP, HELP syndrome in serious pregnancy complication characterized by hemolysis of RBCs, high liver enzyme and low platelet count. Now, coming to the treatment, that is, how do healthcare professionals diagnose diabetes insipidus? And after which we'll be discussing obviously about the treatment. So first is the analysis of urine with respect to its color to check the concentration. The more diluted the urine is, the more transparent it is. The glucose level for diabetes mellitus, which we'll be discussing in later sessions. Blood test to determine the level of sodium and other drugs. Water deprivation test involves not drinking liquid for several hours and measurement of urine, fast, weight, change in blood concentration, MRI to check damage to hypothalamus and pituitary glands, stimulation tests. Intravenous solution is given to produce antidiuretic hormone, and the amount of copeptin is measured. Copeptin increases with increase in antidiuretic hormone or vasopressin, which are the same thing. Results show if you have diabetes insipidus or polydipsia. Now coming to the treatment. Drink enough water to keep the body hydrated if you have diabetes insipidus, but then the rate of urination increases. So the treatment of central diabetes insipidus is done with man-made hormone desmopressin. Since the patients of central diabetes insipidus do not produce vasopressin, nephrogenic diabetes insipidus, balance of calcium potassium medicines like thiazides, a class of diuretics prescribed to reduce urine formation, it might go away with treatment. The next type is dipsogenic diabetes insipidus. No effective treatment available. Sucking sugar-free candies helps to moisten the mouth, increase saliva flow, and decrease the urge of thirst. Gestational diabetes insipidus is treated with desmopressin. The placental enzymes do not destroy this hormone. It goes away with the birth of the baby and may return if the patient gets pregnant again. However, people with diabetes insipidus can prevent serious problem and live a normal life if they follow the recommendation and diet prescribed by the doctor. So, thank you, like, share, and subscribe.